Hey guys, welcome to Fun Learning. In this video, we are going to discuss about the axilla in detail. With no further delay, let's get started. Axilla is a fat-filled pyramidal shaped space between the upper part of the arm, lateral side of the thoracic wall, pectoral muscle and scapula. This axilla is also known as armpit or axillary fossa. This is a diagram that shows the axilla. From seeing this diagram, we can say that axilla is pyramidal in shape, which has an apex, base and four walls, namely anterior wall, posterior wall, medial wall and the radial wall. Now let us discuss about the apex, base and the four wall of the axilla with the help of the mnemonic. Apex. The apex of axilla is triangular in shape, and the apex of the axilla is also known as cervico-axillary canal. Boundaries. Generally, we have anteriorly we have clavicle bone, posteriorly we have scapula bone, and medially we have ribs. If we remember this, we can easily remember the boundaries of the apex of the axilla. So, anteriorly, posterior border of clavicle, posteriorly upper border of scapula, medially outer border of first rib, and radially we have coracoid process of scapula. Direction. The apex of the axilla is directed upward and medially and continues into the root of the neck, forming cervico-axillary canal. Structure passing through the apex. In order to remember this, you have to remember the mnemonic LAB. In that, L stands for long thoracic nerve, A stands for axillary artery as well as axillary vein, and B stands for cord of brachial plexus. Now let us discuss about the base of the axilla in detail. The base, which is also known as floor, is formed by the skin and the thick layer of axillary fascia. In order to remember the boundaries of the base of the axilla, we have to remember the mnemonic CAP. In that, C stands for chest wall, which forms the medial boundary. A stands for anterior axillary fold, which forms the anterior boundary. P stands for posterior axillary fold, which forms the posterior boundary. Direction. It is directed downward and radially, forms the floor of axilla. Now let us discuss about the four walls of axilla in detail. First, let us discuss about the anterior wall. In order to remember the anterior wall, we have to remember the mnemonic C-SAP. C stands for clavipectoral fascia, S stands for subclavius, A stands for anterior wall, and P stands for pectoris major muscle, all extent, and pectoris minor muscle, the central part. So, in order to remember the structure that is forming the anterior wall, you have to remember the mnemonic C-SAP. Now, let us discuss about the posterior wall. In order to remember the posterior wall, we have to remember the mnemonic PLAST. In that, P stands for posterior wall itself. LA stands for latissimus dorsi, which forms the lower part of the posterior wall. S stands for subscapularis muscle, which forms the upper part of the posterior wall. T stands for teres major muscle, which forms the middle part of the posterior wall. Structure related to this wall. Very easy. We have subscapular vessels, posterior cord of brachial plexus and posterior circumflex humeral vessel. As this is structure related to the posterior wall of the axilla, we can easily remember it by remembering posterior cord of brachial plexus and a posterior circumflex humeral vessel. Now let us discuss about the medial wall of the axilla with the help of the mnemonic. In order to remember the structure that is forming the medial wall of the axilla, we have to remember the mnemonic first. In that, FR stands for upper 5 ribs, I stands for intercostal muscles in the upper 4 intercostal space, as well as intercostobrachial nerve. S stands for serratus anterior muscle, 4 or 5 vegetation, as well as the nerve which is supplying this serratus anterior muscle, which is nothing but long thoracic nerve. In order to remember the structure that is forming the medial wall of the axilla, we have to remember the mnemonic first. Structure related to this wall. We have to remember the mnemonic triple L, 3L. In that, first L stands for lateral thoracic vessel. Second L stands for lateral branch of second to fourth intercostal nerve. And third L stands for long thoracic nerve. Now let us discuss about the erratal wall. In order to remember the structure that is forming the erratal wall of the axilla, we have to remember the mnemonic BC. B stands for bicipital groove, which is present at the upper part of the shaft of humerus, as well as biceps brachii, long head of biceps brachii. And C stands for coracobrachialis. So in order to remember the structure, we have to remember the mnemonic BC. Now let us discuss about the structure related to this wall. You have to remember the mnemonic AB. In that, A stands for axillary vein and the third part of the axillary artery. B stands for brachial plexus, branches of medial and lateral cord of brachial plexus. Now let us discuss about the content of the axilla with the help of the mnemonic. Content of axilla: axillary artery and its 6 branches, axillary vein and its tributaries, brachial plexus, long thoracic nerve, intercostobrachial nerve, axillary group of lymph node, loose auroral tissue with axillary pad of fat, axillary tail of spines in female adult mammary gland. You can remember all this by remembering the mnemonic I lab. I stands for intercostobrachial nerve. L stands for long thoracic nerve as well as loose auroral tissue with axillary pad of fat. A stands for axillary artery, axillary vein, axillary group of lymph node as well as axillary trail of spines in female adult mammary gland. B stands for brachial plexus. Now let us discuss about the clinical application of the axilla in detail. Dislocation of shoulder results in damage to the neurovascular structure in the axilla. Thrombosis of axillary vein. Because of prolonged hyperabducted arm, example in painting the ceiling, post-operative mastectomy with a removal of axillary lymph node can lead to venous stasis and edema of upper limb. Thoracic outlet syndrome, where the vessels and nerves in the axilla get compressed between the clavicle, first rib, scapula, which is known as thoracic outlet syndrome. The common cause is nothing but the fracture of the clavicle. Surgical approach to axilla. As the anterior wall is devoid of bone and the base of the axilla is facial, so the approach is made usually through the anterior wall of the axilla as well as the base of the axilla. Axillary abscesses and its drainage. Axilla is one of the sites prone for infection and abscesses formation because of abundance of sweat and sebaceous gland that is present over there. If the pus is collected over there, and that is usually drained to its base by giving incision midway between the anterior and the posterior axillary fold close to the medial wall to avoid injuring the lateral pectoral nerve which is present at the anterior wall, suprascapular nerve which is present at the posterior wall, axillary vessel which is present at the lateral wall. Compression of long thoracic nerve by enlarged central group of axillary lymph node may also occur. The compression of long thoracic nerve may lead to the damage to the serratus anterior muscle. Axillary lymphadenitis, axillary lymph node biopsy. 75% of lymph from the breast will drain into the axillary lymph node, and biopsy of this lymph node is performed to diagnose carcinoma of breast. When the cancer is diagnosed, the lymph nodes are removed to prevent the spread of the cancer. In order to remember the clinical application, we can easily remember the mnemonic SAT-DC. In that, S stands for surgical approach to axilla, A stands for axillary abscesses and its drainage, axillary lymphadenitis, as well as axillary lymph node biopsy. T stands for thrombosis of axillary vein and the thoracic outlet syndrome. D stands for dislocation of shoulder. C stands for compression of a long thoracic nerve. With this, I'm completing today's video. Thanks for watching. If you like this video, please subscribe to my channel. Thank you. Stay home, stay safe.